All right. Good morning, everyone. Welcome to this morning's webinar presentation, Employee Benefits, the Year in Review. My name is Kathy Purdy, and I'm a marketing manager here at Bond. Just a couple of housekeeping items before we get started. Please use the Q&A box located at the bottom of your screen to submit your questions, and our presenters will do their best to answer those throughout today's program. Once the webinar has ended, if you would take a moment to complete the brief survey, we would appreciate that. Your comments and suggestions for future topics are important to our panelists. In today's panelists, we have DJ Nugent. He's a member of the Employee Benefits Practice Group in our Syracuse office. Larry Fennell. Larry's also a member of the Employee Benefits Practice, and he's in our Red Bank, New Jersey office. And finally, John Godso, who's going to start us off today, is a member in Employee Benefits in our Buffalo office. So John, I'm going to hand it over to you.
Okay, thank you so much, Kathy. Thank you all for joining the webinar this morning. Glad to welcome you along with Larry Fennell and DJ Nugent, discuss some of the major developments over the past 12 months that will shape your compliance efforts in the area of employee benefits, both here at the end of 2021 as well as 2022 in the future. And while we're going to focus really on the last 12 months, you'll notice that a number of the topics will really touch on developments that began to take shape about 18 months ago with the beginning of the pandemic. And certainly, if you recall, and I know many of you do, vividly, the pandemic brought along a flurry of legislation and regulatory activity that we've all had to wrestle with here over the past 18 months. And while the volume has decreased to some degree here in 2021, Congress and the regulators have certainly kept us on our toes still. We've had a few major pieces of legislation, a number of pieces of regulatory guidance, including some important guidance on cybersecurity that Larry is going to talk about here in a moment. Throw in a Cobra subsidy, and it's certainly been a busy year for sure. So if we can go to the next slide, please. Just the roadmap here. We've really organized this with respect to the different areas of what you traditionally think of employee benefits law, touching on the retirement plan review, which Larry is going to start us off with, then go to a health and welfare plan review to DJ. And then finally, I'm going to end with some of the important deadlines, amendment deadlines that are upcoming here, both at the end of 2021 and going into 2022. So with that, I'm going to pass on to Larry to start with the retirement plan review.
Thank you very much, John. Good morning, everyone. I'm happy to be here. I'm going to go through for the next few minutes here a number of different topics that have impacted retirement plans over the past 12 months. And starting off here, we're going to be looking at the DOL cybersecurity guidance. In April of 2021, the DOL issued new guidance, and in many cases, on many accounts, much needed guidance regarding cybersecurity practices to be taken by plan sponsors and fiduciaries, as well as service providers, record keepers, and the like. And in addition, participants and beneficiaries when it comes to plan data. The DOL focused on three specific topics in this guidance. One was the retention and hiring of service providers. Two was, generally speaking, managing cybersecurity risk. And then three was looking at specific online tips for participants and beneficiaries when using plan data and maintaining their own accounts. Although this was deemed as best practices, I think it's safe to say that many look at this as the DOL's minimum standards that they're going to be expecting upon investigation and audit of plan sponsors and service providers. Ultimately, I think we can take from this that the DOL expects that plan sponsors have a duty and fiduciaries have a duty to protect plan data. Although this was geared towards retirement plans, I think it's also safe to say that we can apply these best practices to health and welfare plans as well. Looking at the next slide, hiring service providers, I think the DOL expects fiduciaries and sponsors to act prudently when retaining service providers generally, and as part of that prudent review, they're also expecting service providers to have particular minimum standards of cybersecurity. The DOL suggested a number of different practices for fiduciaries to follow when retaining vendors, One, look at their security standards that they already have in place and assess their industry reputation. Is it sufficient for the data you're going to be sharing with this vendor? And do you need to request either an update or look for a different vendor before you share information and retain that vendor? Look at the prior incidents that they've had. What have their prior breaches been, and how have their responses been to those breaches? Do they have insurance coverage in place? I think all vendors at this point, if you're sharing significant data with them from the plan, should have a cybersecurity insurance policy in place. What are the limits of those policies, and are the limits sufficient to cover, potential damages that the plan will ultimately incur should there be a data breach? Are there any limitations of liability in the service provider contract, either a monetary cap or even a potential timeline cap with respect to data breaches? And is that sufficient, or do you want to look for either a longer period of time for coverage after the end of the contract, or a higher dollar value to ensure that the plan will be protected in the event of a breach? What is the vendor's record retention and destruction policy? And what's their notice policy? How are they going to reach out to you in the event that they suffer a breach? And when are they going to? I think a lot of times the when is even more important than the how, because the when is going to tell you, how many days have elapsed, how many hours have elapsed since you've had a data breach. That way you can ensure that you have a timely response to try to prevent any potential damages stemming from the breach. Looking into the next slide here, the DOL put together some best practices for service providers, and I think these also would be applicable to plan sponsors as well. And I'm going to touch on a few of these here, but the one that sticks out first and foremost is have a well-documented formal cybersecurity program. Put pen to paper and establish how you're going to handle cybersecurity issues, security standards, regular audits, and the like. Conduct regular risk assessments, and in particular, looking at the next bullet there, have a reliable third-party audit and review of your cybersecurity policies. You need to find an expert in this field who's able to look at what you have in place and ensure that it's sufficient, and identify any gaps in coverage so that you can close those gaps before a hacker ends up attacking it. Have strong access control procedures, conduct cybersecurity training, put together a business resiliency program so should you suffer a breach, you'll be able to get back up and running in short order. Make sure that you're encrypting data in transit and in storage, and take a look at how you're responding to cybersecurity incidents. Moving on to the next one, and the DOL put out some cybersecurity tips, and frankly, I think most of these cybersecurity tips are ones that I, for one, can say that I've personally been had drilled into my head by all sorts of different companies, but this is just best practices when it comes to being on the internet. Using a strong password, try to implement multi-factor authentication, regularly monitor your accounts to ensure that you don't have any unauthorized use on those accounts. Avoid public Wi-Fi, updating your site, your antivirus software. If you're not doing these things, be mindful of them. Be careful before you open an email to ensure it's not a phishing attack. I think these are best practices for everyone when going online, and certainly should be hallmarks of any vendor and any plan sponsor and any participant and beneficiary. You're only as strong as your weakest link, and you don't want to have a situation where a participant results in a significant breach. So educating your participants on these points, I think, would be a good idea to the extent you haven't done so already. Next topic up here is the DOL missing participant guidance. If you can jump to the next slide, Kathy. Oh, next one after that. There we go. Sorry about that, everyone. DOL missing participant guidance. The DOL over the past few years have had investigations and audits of plans, and specifically have paid attention to, are you reaching out to all of the missing participants you have out there, and especially the terminated vested participants? When people are reaching normal retirement age, do they know they have a benefit, and is it being paid timely? In January 2021, the DOL issued multiple pieces of guidance looking at what plans are doing to locate missing participants and getting that money out to them. The DOL, couches this as best practices, but I think it would provide insight into how the DOL is going to handle investigation of your plan in the future and assess your missing participant practices as well as your distribution practices. I include here the DOL disclaimer here that this is does not have the force of law and can't bind anyone in any way, and only intended to provide clarity to the public regarding existing requirements. I think that's just their way of making sure that you appreciate this is strictly a missing participant, this is just best practices, but at the same time, I think for everyone on this call, they can appreciate that this is something they should be doing. Moving on to the next slide here, DOL identified a number of red flags in their guidance. And the first step in any issue here is knowing you have a problem. And do you know or should you know you have a problem? And I think they look at a number of different factors to assess whether the plans are aware of what's going on and are they practically handling these issues. First and foremost is how many missing or non-responsive participants do you have? Is it more than a small number? What percentage of participants are quote unquote missing? And of that, how many terminated vested participants are missing? Do you have people who are reaching normal retirement age but aren't starting and commencing distributions from the plan? Taking a look at your plan data to find any missing, inaccurate, or incomplete contact information. Specifically, do you have an incorrect or out of date address or email address? Do you have a partial social security number? Do you have everyone's birth dates or spousal information? If you don't have this information, it's going to be difficult to get a hold of people and make sure that they can actually get payment in a timely fashion. How are you handling undeliverable or returned mail that comes back to you? And are you addressing it when you receive it, or are you just, discarding it? I think it's important to address. These are the flags that pop up that should be a sign that you have bad contact information and you need to take steps to resolve that issue so you can get in touch with the people who have benefits under the plan. Turning to the next slide here, best practices that the DOL has advised. They hit on a number of different things here, and mitigating and minimizing missing participant issues starts with data. And how often do you contact your participants and beneficiaries? And when you contact them, what's the body of that message? Do you say up front that this is you're reaching out about a retirement benefit, or is it something that people are going to regard as junk mail and throw away? Looking at, again, that undeliverable mail or email. If you send an email out and it comes back to you, it bounces back to you, do you have a mechanism in place to flag that so you can take additional action to move forward with it? I think a lot of plans today have online platforms, and I know it's possible you can put in protocols in place so that when you log in, maybe you'll have a pop-up window or something you have to click through that reminds you to update your contact information. I think that's a great opportunity now as people move to more online platforms with their retirement plans to assess and go after take advantage of that and try to get new contact information from people right at the point of logging in. And then requesting information as well as to their beneficiaries and updating that information. Again, being upfront in communications in the mail, making sure that people are aware that this is regarding their retirement benefits and it's not just junk mail. As you onboard people and as you conduct exit interviews, take that opportunity, if you can, to try to update contact information, get a new address. I think this is particularly difficult in COVID when you have so many people working virtually and not working at their traditional home office. If they moved away to work virtually, do you have contact information? Because they may not be going back to where they were living previously. Missing participant searches is something the DOL looked at, and they leave, few stones unturned when it comes to this. I'm going to highlight some of the ones that stuck out to me is, making sure that you review, if you have bad information, does as a plan sponsor, do you have better information maybe in payroll? Or if you looked at related plans, such as the medical plan, do you have better information there? That might be a good starting point to see, well, do you have the most up-to-date contact information available? Do you have information regarding the designated beneficiaries? Can you reach out to them to get updated information on the participant? I think the DOL is in favor of using online searches, whether it be frankly, a simple Google search or something on social media, moving up to even, retaining a professional in this regard to search out people, contacting the United States Postal Service, sending, certified mails to make sure that they come back, or using a FedEx or a UPS with tracking information. Looking for these different opportunities. There's a number of them listed here on this slide. And if you have any other questions about other opportunities, I'd be happy to discuss them with you. But in a nutshell, I think, taking advantage of a lot of the tools you have available to you and putting together a diligent and prudent search method to locate people is integral to, ensuring that you are meeting the DOL's burden with respect to this. And then lastly here, to that end, maintaining a missing participant policy, putting pen to paper and putting together a policy. What is a plan going to do when you get an undeliverable letter back in the mail, when a check goes uncashed? How are you going to deal with these things? Put together a policy and follow that policy, documenting all the decisions you take along the way. I think these are the things that are looked at as the best practices and what the DOL expects from plan sponsors going forward. Just touching base quickly on the next slide, the DOL, in addition to these best practices, put out two other pieces of guidance. They put out Compliance Assistance Release 2021-01 and Field Assistance Bulletin 2021-01. And just just touching on it briefly, in response to a lot of the different DOL audits that were going on, to ensure that auditors were consistently treating all plans equally in their investigation, they put out an alert that, to ensure that, during these plan audits, missing participant procedures were being viewed, equally across the board. In Field Assistance Bulletin, in the Field Assistance Bulletin, they also provided some temporary relief to terminating plans who wanted to use the PBGC's missing participant program, so they can transfer assets to the PBGC to be monitored and take advantage of the tools they have in place to locate missing participants, recognizing that during COVID, a lot of employers and employees weren't as in touch as they used to be because they were working virtually. So these are two things. I'm just going to mention them so you know them. If you have any questions specifically that you may have about them, please feel free to reach out. I'd be happy to discuss it with you in more detail. Next up, we're going to look at the Secure Act. The Secure Act put out, two things we're going to touch on today. The first of which is lifetime income illustrations. And under the Secure Act, the defined contribution plans are now required to include lifetime income stream disclosures. Now, generally speaking, sponsors have always been obligated to send out benefit statements to their participants. For non-participant directed plans, they have to put them out at least annually. And for a participant directed plan, at least quarterly, include a total benefits accrued balance on those statements. Now, the new rule follows that same protocol, but adds two additional pieces of information: the lifetime income illustrations. In addition to the prior information, disclosures must now include a single life annuity and a joint survivor annuity, so that participants can see if they were to convert their balance into a stream of payment option down the road, how much would that be based upon their current balance. Now, this rule becomes effective 12 months after the DOL issues regulations and a model disclosure. So the DOL did that on September 18th, 2020. So this took effect on September 18th, 2021. Now, as far as deadlines go, participant directed plans have 12 months. Remember, they have to put these out at least quarterly. So they have 12 months from September 18th, 2021, meaning that they have to comply no later than the first or second quarter of 2022. As if they wait till September 30th, 2022, the third quarter, they'll be too late on that. For a non-participant directed plan, the first plan year ending after September 19th, 2021. So you're talking about statements for the 2021 calendar year. October 15th, 2022 would be the last day for the timely filing of the 2021 annual return. The second piece of guidance, just turning to the next slide here, regards the coverage of long-term part-time employees. The Secure Act also included new provisions to ensure that certain part-time employees have an opportunity to make elective deferrals under 401k plans. Currently, plan sponsors can Sorry about that. Currently, plan sponsors can include a requirement that employees must work at least 1,000 hours to make elective deferrals. Under the new law, certain quote unquote long-term part-time employees will have the right to make those elective deferrals under 401k plans. Now, a long-term part-time employee is defined as a part-time employee who works at least 500 hours a year in 3 consecutive plan years. These individuals will have the right to make elective deferrals under your 401k plan. However, plan sponsors won't be required to provide matching or profit sharing or other non-elective contributions to these individuals. Now, this is going to be effective as of the first plan year after December 31, 2020, but that's just the counting requirement. So for now, for 2021, 22, and 23, sponsors must be mindful that they have to have a record system in place so that they can count these hours. Up until 2023, if I counted that correctly, they won't have to actually have long-term part-time employees making elective deferrals in the plan. So I think the takeaway here for now is to make sure that as a plan sponsor or a record keeper, you have the means to put together a proper, retain a proper amount of hours so that employees know, so that in 3 years from now, you'll know who is eligible to start participating under this rule. Moving ahead, the next major piece of legislation that impacted employee benefits was APRA, in particular, the multi-employer plan relief provision. That's what we're going to touch on now. And in July 2021, the PBGC added a new interim rule providing special financial assistance to troubled multi-employer plans. I think you're focusing here on certain plans which are either in endangered, critical, or critical and declining status, at a time when they may have incurred large losses from the COVID-19 pandemic. Under the plan, this special financial assistance will provide those recipient plans with funds sufficient to make benefit payments through 2051 and restore previously suspended benefits. I mean, the PBGC anticipates that this will impact over 200 multi-employer plans and 3 million participants. This is a major piece of legislation and over needed relief to a lot of multi-employer plans that were in dire straits. Looking at the next slide, first point, which plans are going to be eligible here? And essentially, again, you're looking at, troubled plans that are in critical and declining status in, 2020, 2021, and 2022. Those who have already previously suspended benefits as of March 11th, 2021. Those that have a modified funding percentage under 40% and a ratio of active to inactive of 2 to 3, and plans that may have become insolvent after December 16th, 2014. So unfortunately, it's going to apply to a lot of different plans here, but there's specific targeted plans that Congress had in mind when they put together this relief here. Moving ahead, and I guess, those are the plans that are eligible, but what is special financial assistance? And it's going to be an amount required to pay all plan benefits due during this period, starting on the date of receipt and ending in 2051. So for the next 30 years, you're talking benefit payments. In addition to benefit payments, it's also going to include benefit expenses that are associated with running the plan. In addition, you're going to be able to reinstate any previously suspended benefits and provide a payment for past due amounts that were lost as a result of those suspensions. So again, 30 years of pension payments, it's a significant amount of money that's going to be going to a lot of these different plans. Moving on to the next slide, though, as part of the relief here, there's going to be certain restrictions and conditions that are going to be placed on plans for receiving that. And as a result, if plans receive that relief, they're going to have a limitation on their ability to adjust, future benefit accrual rates and implement retroactive benefit improvements. So just because you're getting this SFA money, you're not going to be able to go back and, increase benefits in light of that here, allocating and reallocating plan assets to, other plans and reducing in contribution rates. You're not going to be allowed to do that as well. Diverting contributions to other plans and, the rules regarding withdrawal liability all are going to be impacted here. So there's going to be some stiff restrictions on plans to make changes to ensure that the SFA money that's being given to this plan ultimately goes and pays these benefits. The idea here being that Congress didn't intend to provide this relief and then have plans essentially make decisions that result in them creating greater financial loss here. The goal here is to make sure that the money that goes into these plans ends up in the hands of the participants. To that end, going to the next slide here, there's specific topics here that I'm going to touch on. One, separation. SFA is going to go to these plans. If you can jump to the next slide, Kathy. There you go. SFA is going to go to these plans, but it's not going to it's going to be segregated out from the assets currently under management to ensure that these monies are only used to pay benefits and eligible plan expenses. SFA money is going to be invested in very specific investments, investment grade bonds, or other investments that are ultimately provided by the PBGC. The idea being that this money should be, maintain liquidity so that it can be used to pay benefits and expenses. The plans aren't going to be able to increase benefits based on the uses of SFA funds, and any benefit increases that come forward must be certified by the plan actuary to be attainable using current plan assets and an increase in employer contributions. Plans are not going to be allowed to reduce a contributing employer's burden here. Generally speaking, they're going to have to maintain the agreed upon contribution rates and increases through the expiration of the current collective bargaining agreement. Allocating contributions and expenses. You can continue to pay expenses between plans, and if you have a expense sharing agreement between one plan and another plan, you can continue to do so. But it's the idea here is that they are going to prohibit the use of these funds to maybe establish a new plan. Only good faith, cost sharing is going to be allowed, and no transfers or mergers. You're not going to be able to, transfer any or divert these assets to another plan. They're going to have to stay here unless the PBGC approves that the SFA is going to the recipient plan to be used to pay their benefits and their expenses. Turning to the next slide here, and I think this is some of the more significant, piece here is the impact on withdrawal liability. And Congress didn't, want to make it easier for employers to walk away from plans after they get this infusion of cash, because as a result of this, the ability to pay benefits will increase, but also, reduce the withdrawal liability calculation as well. So as a condition of receiving SFA relief, plans will have to be, forced to use the mass withdrawal interest rates to apply to calculating withdrawal liability for withdrawing employers. Mass withdrawal liability rates are interest rates are, generally speaking, much lower than the ones the plan would traditionally use to calculate withdrawal liability, resulting in a much higher potential withdrawal liability amount. Of course, anytime you're talking about withdrawal liability, it's facts and circumstances specific. If you have concerns as an employer who's considering withdrawal, you may want to look at who are you contributing money to, what's the financial status of the plan, and if you were to anticipate the SFA relief, will you be better off waiting until the plan receives special financial assistance before triggering that withdrawal, or do you want to make sure that you get the withdrawal in place beforehand? As an additional wrinkle, following the receipt of SFA monies, the PBGC has to approve any withdrawal liability settlement if that present value is over 50 million. Again, another wrinkle here, making it more difficult potentially for employers to withdraw from a multi-employer plan. So depending on where you stand right now, it may be a good time to assess where you are, and if you're considering a withdrawal in the near future, from a plan that might fall into one of these categories, make sure you do so ahead of time. The last topic of the day is the update to the IRS correction procedures. And I think a lot of you may be familiar with EPCRS, EPCRS is the system used to correct plan qualification for errors. It contains self-correction, VCP, voluntary correction program, and then, obviously corrections upon audit, the audit cap here. The IRS took a look at this and they updated the self-correction, allowing plans who traditionally would have 2 years to correct an error, an additional year. So now having up until the end of the 3rd year following the plan year when the failure occurred to make a self-correction, which is the easiest way, doesn't require any application to the IRS. The IRS also eliminated anonymous submissions, generally speaking, as of January 1, 2022. So any anonymous submission for a correction will no longer be permitted. Overpayments, the IRS addressed, specific relief correcting overpayments, allowing the recipient plan to repay an overpayment with a single, the recipient of an overpayment, the participant can now make a single payment, installment payment, or can repay any overpayment through a reduction in future benefit payments. Turning to the next slide, the IRS, and this also kind of applies to the overpayment here, but also addressed and increased the de minimis correction procedures, where plans are generally required to make full correction of errors, but there was always an exception for errors where the amount was $100 or less. Now the amount has been changed from $100 to $250, and plans are no longer required to correct for those types of corrections. So if you have a small error that involves $250 or less, it's improper distribution or contribution, no corrective action is required. The IRS expanded the self-correction for operational failures with retroactive amendments, and now allows plans to correct plan operation failures through certain retroactive amendments, changes in increasing benefits, rights, and features. In the past, these would have to be applied to all participants. Now plans can correct for these errors, looking at the impacted parties, reducing the cost of these corrections. But ultimately, these are viewed as new opportunities to correct things in a much less costly fashion, and is a breath of fresh air, I think, to most plan sponsors who have been dealing with unfortunate errors in operation in the past. But that's all I have today. I know we covered a lot. If anyone has any particular questions, I tried to go through that relatively quickly, but please feel free to reach out to me or anyone here at Bond. Would be happy to help you out. Now, with that being said, DJ, by all means, turning it over to you.
Thanks so much, Larry. So the first topic that I'm going to talk about are COVID-19 vaccine premium discounts and surcharge programs. This is an issue that came up really at the start of this year, middle of this year, with the widespread availability of COVID-19 vaccines for most adults and some children. A lot of employers wanted to incentivize their employees, if they weren't mandating it, they just encourage them to receive the vaccine. And there's several different ways in which employers can generally incentivize their employees to get the vaccine. The way I'm going to talk about today is really just vaccine premium discounts and surcharge programs. You may remember several months ago, there was a news coverage of Delta Airlines announcing that they were going to charge their unvaccinated employees more for health insurance coverage than they were going to charge their vaccinated employees. And this really put the idea in a lot of employers' minds whether they could do the same thing. There's a general rule under HIPAA that prohibits plans and issuers from using health factors to discriminate among similarly situated individuals. In the case of vaccine incentive, the vaccination status would be the health factor. However, there's an exception to that general rule for wellness programs that would allow a wellness program to essentially discriminate based on a health factor for similarly situated individuals. Many employers, have wellness programs already, either for smoking cessation or just general wellness. So it's a similar program to that. You can either have a standalone for COVID vaccination, or you can amend your existing wellness program to add the COVID vaccine component to it. Like I said, a lot of employers already have wellness programs, but just something as a refresher and to be aware of. They are subject to a myriad of legal issues, including under HIPAA, the Americans with Disabilities Act, GINA, the ACA, and there can be issues under other laws as well, such as ERISA and Cobra. So these programs are generally permissible so long as all of the requirements are met. Now, there was a question of whether the COVID-19 vaccine incentive programs would be permissible at all under HIPAA, even after the Delta Airlines announcement, because there hadn't been firm guidance issued on this topic. Luckily, FAQs were issued in October of this year that the applicable agencies confirmed that, yes, they are permissible. So that was a nice piece of guidance we got this year. I'm going to talk about that a little later. There was also some guidance from the EEOC, which is the agency that administers the Americans with Disabilities Act, in May that provided some additional guidance on COVID-19 vaccine incentives. And just something else to keep an eye on, it may come out today or hopefully this week is what we've been told, is that there's going to be the OSHA rule that applies to private employers with 100 or more employees that essentially says your employees either need to be vaccinated or test out once a week. We're unsure what that rule is going to say and if it's going to have any implications on these vaccine premium discount and surcharge programs, but just something to keep in mind and to be aware of that rule is coming out. Next slide, please, Kathy. So like I said, there was HIPAA guidance that was issued this October that did confirm that vaccine premium discounts and surcharge programs are permissible so long as requirements are met. One nice thing that this guidance did is it confirmed that these types of programs must meet the HIPAA health contingent activity only wellness program rules. There are a variety of categories of rules under the HIPAA wellness program rules that these programs can fall into. So that was good to get clarification on what rules we're dealing with. Now, what those rules require, there are several different requirements. I'm just going to touch on two of the biggest ones in detail right now, but I've listed the others here on the slide. Incentive limitations. What the HIPAA wellness program rules say is that the incentive limitation cannot exceed 30% of the total cost of health insurance for the year, both employer and employee cost sharing provisions. As an example, if the total cost of health insurance for the year, both employer and employee contributions, is $10,000, the plan could charge unvaccinated employees $13,000 and vaccinated employees $10,000. Conversely, they could charge vaccinated employees $7,000 and unvaccinated employees $10,000 using those 30% numbers. If your wellness program for the COVID-19 vaccine is part of a wellness program that also has a tobacco cessation program, that incentive limitation can go up to 50%, depending on how the programs are structured, but just be aware that that limit can be increased. Second biggest requirement of these HIPAA rules is the reasonable alternative standard requirement. Very similar to the ADA reasonable accommodation analysis. What the reasonable alternative standard requirement says is if you are going to implement a vaccine premium discount or surcharge program, you need to notify employees and then deal with notifications if you get them back from the employees that essentially the employee says, I cannot be vaccinated due to a medical reason, or my doctor has told me it's inadvisable to be vaccinated due to a medical reason. If an employee comes to you with that, you need to either give them an alternative standard to obtain the incentive, so that the discounted health insurance in this case, or just waive the standard. You should be aware that if you're giving an alternative standard, that other issues can come up, as there are some alternative standards would also trigger its own alternative standard, so it can snowball. So many employers have just waived the standard, but that's not the sole requirement. You can provide the alternative standard. Other requirements that need to be met are frequency of reward, reasonable design, uniform availability, and notice of availability. These aren't huge hoops to jump through, but just something to be aware of. And if you have questions, if you want to implement one of these programs, of course, reach out to any of us and we can help discuss those requirements with you just to make sure that they're being met. In addition to HIPAA, as a general statement, the ADA's reasonable accommodation analysis requirement will apply. So in any event, if you're an employer who's going to implement one of these vaccine premium discount programs, you need to be doing a reasonable accommodation analysis for either religious beliefs or medical issues that the employee is saying, I can't get the vaccine due to a religious belief or a medical issue. Therefore, I still want to receive the incentive. Just be aware that you need to go through that analysis if those issues come up, and also keep medical information that you receive from your employees confidential, generally separate from the employee's personnel file to help maintain that confidentiality. Now, those ADA rules apply on a global scale. The ADA also has its own vaccine incentive limitation in addition to HIPAA's incentive limitation. And what the guidance that was issued earlier this year from the EEOC said is that COVID-19 vaccine incentives are permissible so long as the incentive is, quote, not so substantial as to be coercive. There's no guidance on what not so substantial as to be coercive means. Our read of that statement, and many others read as well based on all the facts that we know, the ADA incentive limitation is much lower than HIPAA's incentive limitation. So it's much lower than that 30% of the total cost of health insurance for the year threshold. The good news is that ADA incentive limitation is not going to apply to many employers. It will not apply, according to the EEOC, if the vaccine is administered by a third-party provider that is not contracted by the employer. This is very generally the case. Employer tells employees that they are eligible for an incentive if they become vaccinated, if they go out into the community and they receive a vaccine from either their doctor or a pharmacy or a government-run vaccine center, and then just merely show proof or tell the employer that they've been vaccinated, however you want to handle that, the substantiation requirement. In that instance, the ADA's incentive limitation will not apply, but HIPAA's will. The ADA's incentive limitation will apply if you're an employer who either has the ability to give COVID vaccines yourself, an employee can give them, or you've contracted with a third party, CVS or some other group, to come into the workplace and give the COVID-19 vaccine. In those instances, the ADA incentive limitation will apply. So just things to be aware of there, that you generally can provide incentives to employees through the use of discounted health insurance for vaccinated employees or more expensive health insurance for unvaccinated employees, but just be aware that there are restrictions and rules that you need to meet. The HIPAA guidance also clarified a few other things. There had been discussion among employer groups about, well, what else can we do to unvaccinated employees to try and incentivize them to get the COVID vaccine, or essentially punish them if they haven't. One such discussion that had been had, a lot of people talked about it on the internet, was, can we just deny coverage for unvaccinated employees? Or alternatively, can we deny COVID coverage for unvaccinated employees? The HIPAA guidance clarified that you cannot do that. That is definitely discriminating based on a health factor, and it does not fall within the wellness program exception to that rule, so you cannot go down that path. Another issue to be aware of with vaccine premium discount and surcharge programs is that they can implicate issues under your ACA affordability analysis as part of the employer mandate. There's, the rules are you have to offer coverage and that the coverage has to be affordable. Just be aware that if you're thinking of offering one of these programs, that they will implicate those ACA affordability requirements. So the takeaway with this topic is, if you're interested in implementing a COVID vaccine premium discount or surcharge program, you can do so long as the requirements are met. There's been several pieces of helpful guidance this year that we can look to when you're trying to structure these programs, and also just to keep an eye out for that OSHA rule that's coming out to see if that rule implicates vaccine incentive programs at all. So next slide, please, Kathy. Turning to the second topic that I'm going to cover today, are CAA group health plan provisions. There were several developments with the CAA group health plan provisions this year. You may remember that at the end of 2020, there was a law passed called the Consolidated Appropriations Act of 2021 and COVID-related Tax Relief Act of 2020. This was a very large bill. It touched on a variety of topics, but some of the topics that it did touch on implicate group health plan provisions. Now, we have in the past done a webinar on this statute and the requirements that were imposed by this statute, so I'm not going to get into them in a lot of detail, but I have listed them here on the slide with the effective dates. So the new rules that were imposed by the CAA on group health plans, some new rules regarding surprise medical billing, patient choice provisions, new rules providing transparency in healthcare, continuity of care, parity in mental health and substance use disorder benefits, and reporting pharmacy benefits and drug costs. I'm only going to talk about several of these new rules today in greater detail. If I'm not going to speak about them in greater detail, I've tried to include a small blurb about what those new rules entail and their effective date on this slide. But if you have any questions, of course, just let us know. Now, that was at the end of 2020. In 2021, there was 3 developments with respect to these group health plan provisions in the CAA. In July, the first interim rule, it was regulation, was issued regarding surprise medical billing. And I'm going to get into that on the next slide. I'm going to call that rule the July rule. In August of this year, FAQs were issued by the DOL, the IRS, and HHS that either delayed effective dates of some of these rules, deferred enforcement, or stated that we're not delaying enforcement. So that was very helpful guidance. And then in September, a second interim rule was issued that regards fee dispute resolution under the surprise medical billing rules. And I'm going to talk about that in a little bit more detail later on, but I'm going to refer to that as the September rule. So next slide, please, Kathy. This is one of the topics that I'm going to talk about in more detail are the surprise medical billing rules. And essentially what these rules said is effective for plan years or contracts entered into or renewed on or after January 1, 2022. There are new rules that prohibit surprise medical billing and talk about cost sharing for participants with respect to surprise medical billing in several instances. 1 is emergency services, 2 is non-emergency services performed by non-participating providers at certain facilities, and the 3rd is air ambulance services by non-participating providers. There's also a section in there about a fee dispute resolution system between the plans and providers to figure out how to pay those out-of-network rates. I'll get into that in a little bit more detail. But just as an example of what these new rules imposed, I'll take emergency services, for instance. If somebody is in an accident and is taken to an emergency room that is out of their plan's network, obviously the facility is going to have a different rate than the plan or insurer is going to pay, and there would be a difference. There are rules now that prohibit different cost sharing for participants in that instance. Essentially, you need to treat the participant like they receive that care from an in-network facility. Now, that creates an issue where the facility is saying, I'm owed an amount of money that the plan isn't going to pay. The plan and the facility have a 30-day period to negotiate that rate. If no rate can be negotiated, then they can go to the independent dispute resolution system through the federal government. Some developments this year that are helping plans and issuers and providers implement these rules. In July, the first interim rule discussed how to calculate cost sharing amounts for participants who fall into this category, what amounts they can be charged for these out-of-network services. It also discussed how to calculate out-of-network rates that are to be paid to the provider or facility. The September rule set up that independent dispute resolution system that if the providers and plans cannot reach resolution in their open negotiation period, they can go to the federal government's IDR entity and have that entity determine what amount the provider is going to be paid, what amount the plan is responsible for. So there's a lot of information in both of these rules about how that all works. The IDR system is now effective as of October 7, 2021. So that's good because these rules are going to take effect in January 1 of 2022 for plan years that start in that year. Next slide, please, Kathy. Second topic that I want to speak about in more detail under the CAA are the transparency and healthcare provisions of the CAA. Now, there are a lot of rules under this heading of transparency and healthcare. I've just put a very brief description of these rules up here with their effective dates. Of course, if you have questions about how these need to be implemented, ask us. But in general, what the transparency and healthcare rules require is that in and out of network deductibles and limitations have information disclosures, both on the plan's website and on insurance ID cards. There's new rules regarding advanced cost estimates. There's new rules regarding information that must be provided to participants either upon request or upon their scheduled appointments. There's a requirement that plans and insurance issuers maintain a price comparison tool regarding different cost sharing amounts. There's also a requirement that plans and issuers maintain provider directory information for participants to see what providers are available. There's disclosure requirements on the prohibition on balance billing. There has been a model disclosure notice issued on this requirement. And again, this rule is going to take effect January 1, 2022. So that's something you may want to look at now, is what that model notice is. And if you have any questions or need to help in getting that notice out. And then another rule as part of this transparency in healthcare is the prohibition on gag clauses for price and quality information. Again, I've listed the effective dates that were in the CAA for all of these and just very briefly described what they are. There's a lot of detail for each of these requirements that, of course, we can help answer questions on. Now, luckily, in 2021, the FAQs did touch on some of these transparency and healthcare provisions, and in several ways. First, the enforcement of the requirement for plans to post on their website information disclosing in-network rates and out-of-network allowed amounts and bill charges has been deferred until July 1, 2022 for plan years that begin January 1, 2022. So essentially a half-year deferral of when you need to be able to meet that requirement. The FAQs also say enforcement of the requirement to offer a price comparison tool by telephone and make available on the plan or issuer's website a price comparison tool comparing the amount of cost sharing has been deferred until plan years beginning on or after January 1, 2023. So that's essentially a 1 year delay there. The enforcement of the advanced cost estimate rules has been deferred until the agencies can essentially issue regulations. They're not willing to put a concrete date on when that rule is going to come into effect. They're still working on regulations there. The takeaway with these transparency and healthcare rules are there's a lot of new requirements that are imposed on plans and issuers. If you're a self-insured plan, you may be looking at these thinking, well, how are we really going to maintain information on our website? The takeaway is make sure you're speaking with your third-party administrator and other service providers, just starting those conversations and making sure that they're either going to do it, or if they're not going to do it, reach out to us and we can talk about what the requirements are. If you offer a fully insured plan, just have conversations with your insurers to make sure that they're doing what they're supposed to be doing. Next slide, please, Kathy. Third topic I'm going to discuss very briefly is the CAA's reporting pharmacy benefits and drug costs. What the CAA requires for this topic is that group health plans and health insurance issuers are required to make an annual report to the federal government of data relating to prescription drug expenditures. And there's a large list of information that needs to be reported to the federal government. I've just included some examples of what that information is. This is non-exhaustive. For example, the 50 most frequently dispensed brand prescription drugs and the total number of paid claims for each such drug. That's just one type of thing that you're going to need to be able to report. In 2021, no regulations had been issued, but they are anticipated on this requirement. Now, the FAQs did defer enforcement of the first and second reporting deadlines of this requirement. The first reporting deadline was going to be December 27th of this year, and the second reporting deadline was going to be June 1 of next year. Those deadlines have been extended. However, what the departments say in these FAQs is that they strongly encourage plans to start working to ensure that they're in a position to be able to begin reporting the required information with respect to 2020 and 2021 by December 27 of 2022. I think we can read into this statement by the departments is saying these deadlines have been extended. If you're not in a position to report by December 27, 2022, there may not be much leniency from the departments for failure to be able to report by that date. So just keep that in mind. Next slide, please, Kathy. Just the general takeaways of these CAA group health plan provisions. They were part of the CAA in 2020. There's a lot of a lot of new rules and not a lot of new information that plans and health insurance issuers need to be aware of. Just make sure you're aware of them and make sure you're aware of the guidance that was issued in 2021. Again, if you're a self-insured plan, make sure you're speaking with your third-party administrators and service providers to determine what steps they're going to take to make sure you're in compliance. And if you're a fully insured plan, make sure that your insurers are doing what they're required to do. Again, some deadlines have been extended, but many of them have not been extended. So, and many of these deadlines take effect January 1, 2022. So be ready to have these requirements ready to roll out. If there have not been regulations issued, what the agencies have said is that if there's no regs and no deadlines extended, you need to still implement these new rules using a reasonable good faith interpretation of the statute. So just essentially do your best to comply with the terms of the statute before any additional information is issued. And just keep in mind, even though deadlines have been extended or enforcement deferred, don't just push it off to the side and forget about it. Try to keep it top of mind, because again, in the instances where deadlines have been extended or enforcement deferred, if you can't meet the extended deadlines, the agencies may not be very lenient with you if you cannot meet the extended deadlines. So with that, that's all I have, and I'll turn it over to John Godso to take it away.
Thank you, DJ and Larry. I'm going to take us home here with starting a conversation about some COVID-related issues, and then finish with some amendment deadlines that we should keep in mind with respect to both 2021 and 2022 changes. So the first slide that we're looking at here is the extended timeframes for the COVID-19 national emergency. And many of you may remember back in 2020, there was a piece of guidance that I'm going to refer to here as a joint notice. It was issued both by the IRS, Treasury, and the Department of Labor. And that notice basically extended certain claim, election, and payment deadlines until what was referred to as the end of the outbreak period. And the outbreak period was basically the end of the declared national emergency plus 60 days. So we are still in the outbreak period. The national emergency is still ongoing, so we have not reached the end of the outbreak period. So this was an ongoing time period that the plan administrators had to struggle a little bit with, because there really was no deadline, for example, for Cobra elections. Things of that nature we had to struggle with as far as when was the actual time that folks had to tell us about their Cobra election. Other types of changes like special enrollment changes, those also were impacted by these rules. So then in the early 2021, we got a bit of new guidance from the departments and clarified that these disregarded periods, and the disregarded period is basically that time period in which we don't count. So for example, if there's a 60-day election period with respect to Cobra, we're not counting any time period during that disregarded period until, at least under the initial guidance, until the end of the outbreak period, and then the 60 days began to run. The notice clarified that basically per the statute, we can go no longer than a 1 year of a disregarded period. So it was not indefinitely extended based on the declared national emergency, which again is still ongoing. So that period now, that disregarded period where you don't start counting those 60 days, for example, with respect to Cobra, ends the earlier of 1 year from the beginning of the applicable period. So let's say the applicable period, again, just to take Cobra as an example, is the day that you can make an election to elect Cobra, or the end of the outbreak period. So if the national emergency does end and the outbreak period ends, if that occurs, and again, the outbreak period is 60 days after the end of the national emergency. If that occurs first, then that's the end of the disregarded period, and you start counting your days at that point. So we had that guidance, which was helpful, that put a little bit more definitiveness on when the ends of these periods are for these various elections that are specified in the joint notice. Most recently, we got additional guidance, and then this really relates to Cobra specifically, that talks about, well, all right, we have this 1 year period, maybe shorter if the outbreak period ends. How does that work with respect to both Cobra elections and payment obligations? So if you recall, the general rule under Cobra is we have the 60 days to elect Cobra, then there's another 45 days after that to make the first payment. So if you wait a year, for example, to make your election, and then have this 45-day period to make the first payment, do we get a year after that 45-day period, or do those time periods run concurrently? And basically what was concluded in this notice is those time periods run concurrently. So there's not this 2 years plus period in order to get the first Cobra premium payment under these rules, these extended election periods. So that was helpful guidance from the departments. Another issue that's guidance addressed, and there was many areas, I'm just going to focus, I think, on one of the two main ones. The notice addressed also the extended time periods under ARPA for notice or election periods, and basically said those extended election periods, these 1 year periods and outbreak periods, don't apply with respect to the ARPA Cobra subsidy. So for example, we can't have someone elect Cobra in January of 2022 back to during a subsidy period, say for example, August 2021, and receive the subsidy as a result of that election. Those periods do not, these extended election periods do not apply with respect to ARPA notice or election periods. So that was helpful guidance as far as how those periods apply with respect to ARPA. If you've been keeping track of that, the end of the ARPA Cobra subsidy period was the end of September. So we're really beyond those time periods where we're talking about subsidizing someone's Cobra, at least pursuant to the federal statute. If we can move on to the next slide, please. So amendments. DJ talked about the CAA. In my experience, things came fast and furious with all the guidance that was issued over the past year. And if you recall, the CAA liberalized a number of rules regarding election changes. Now, if you recall, for our cafeteria plans and flexible spending accounts, there are very strict rules regarding when we can make election changes. There has to be a qualifying event, change in status, in order for someone to change their pre-tax election, either with respect to their premiums or with respect to the FSAs. The CAA temporarily liberalized those rules in a number of ways. And I think a lot of employers implemented these during 2021 and haven't yet thought about what we have to do now to our plan documents in order to memorialize that. And if you recall, the general rule with these pre-tax elections is that the amendment has to be prospective. For example, if you make a change in 2021, the typical rule is you have to make that before the 2021 plan year and can't make it at the end of 2021 to apply retroactively back to 1/1/2021. The CAA changed those, and we're talking about that in a minute, or provided guidance, or there's guidance issued by the IRS following the CAA that allows employers to adopt amendments that implement these changes administratively, for example, in 2020 or 2021, to adopt those amendments at a later date, which usually wouldn't be permitted under the IRS rules. So we can look at here, if you've made any of these changes, and there were a number of changes regarding allowing folks to make mid-year election changes with respect to their FSA, and most of these changes were designed, or employers were considering these to help out the employees. It might be that there was not needed extra flexible spending account monies for whatever reason, because of COVID impacted the amount of time or the number of times that folks went to the doctor, or might have changed their dependent care needs. So this was really designed to permit more flexibility for employees, participants, to make changes to their elections that normally wouldn't be permitted under the typical rules. So you had this issue of now, if implemented by the employer, you can make mid-year election changes. You could carry over unused balances, not subject to the normally applicable limits for carryovers for the 2021 or 2020 plan years. You could have extended grace periods with respect to your FSAs, and there were changed rules regarding the maximum age for dependent care assistance. We also received some clarification, Notice 2021-15, that talked about cafeteria plan elections and the ability to stop those elections and change out of a health insurance option, for example, and get into a different health insurance option. So we had all this guidance, employers were considering it and making changes on the fly, and we weren't necessarily amending our plans to keep up with our administrative changes. So if we can go to the next slide. What the guidance from the IRS allowed us in that 2021-15 that I just mentioned was a liberalized time period in order to amend our plans to comply with these changes if we implemented them. So I start here on this slide saying it's important to note that they're optional. So if you didn't implement any of these changes, there's no need to amend for them. And they're temporary. These are not, unless extended by Congress, these are not permanent changes. They're mostly for the 2020 and 2021 plan years. However, if we did implement any of those changes, a plan amendment is required. And the timing on that is the general rule is the deadline is the last day of the first calendar year that begins following the plan year in which the change is adopted. So for a calendar year plan, which most of us maintain typically with respect to our FSAs and our cafeteria plan, if a change was adopted that impacts the 2020 plan year. So for example, if you allowed for carryovers, unlimited carryovers from 2020 to 2021, your amendment deadline for that change is December 31st, 2021. Depending if you implemented a change for and you had a calendar year plan for 2021, the amendment deadline would be 2022. But we should keep that in mind if we did implement some of these changes, because I think our administrative practices and trying to help out employees came ahead maybe of our plan document practices and keeping what our plan said in line with what the IRS requirements are. If we can go to the next slide, please. Another change that was really impacted through COVID was as part of the CARES Act, which was back in 2020. It amended the definition of what a qualified medical expense is. And those would be definitions typically within your health FSA plan, for example, what's reimbursable pursuant to the plan, to include over-the-counter medications without a prescription and menstrual care products. So these amounts where the over-the-counter medications without a prescription used to be allowed back when I think it was the ACA came into effect. That got stripped from being a qualified medical expense. The CARES Act changed it, so now we could again reimburse over-the-counter medications without a prescription. So, and plans were permitted. The CARES Act came, I forget, in March of 2020. Plans were permitted to have these expenses reimbursable retroactively to January 1, 2020, even though the legislation didn't occur later in the year. Now, my experience with this, with working with plan sponsors and clients, is that many times their FSA third-party administrators implemented this change or gave a notice of an implementation of this change automatically. And now we just have to catch up to where we are administratively. I think most are allowing these changes. So if we did adopt this change and we adopted it effective as of the earliest date, which was January 1, 2020, our amendment deadline now is December 31st, 2021 to put that into effect. So something to think about with your health FSA definitions and qualified medical expenses. If we go to the next slide, please. So more health FSA issues that came up as a result of pandemic-related changes. IRS Notice 2020-33 modified the carryover rules. Now, if you recall, if you have an FSA, typically you have a grace period, which is an extended period to incur claims that may be reimbursable and paid from your prior year FSA election, or a carryover. And that carryover would be a flat amount based on what's left over from unpaid claims from the prior year. Now, traditionally, the carryover was capped at $500 and did not get indexed similarly to your health flexible spending account, which changes each year based on IRS indexing. IRS changed that rule now, basically index the carryover limit as well, in addition to the maximum health FSA amount that can go into the plan. So previously we were at 500. That now is changed to 550. Future increases will be changed depending on the indexing by $10 each period. If a plan administratively permitted that carryover limit from 2020 to 2021, that was the first time that you could do that. Your amendment deadline is December 31st, 2021. Similarly, if the first time you did it was this year, your amendment deadline is the end of next year. So that's where we are with respect to amendments for the carryover. If we can go to the next slide, please. Retirement plan amendment deadlines. Let's talk about, we've got 4 that we're going to talk about in 2021 and 2022. First, the Bipartisan Budget Act of 2018 really modified the hardship distribution rules. Now we're stepping back a few years, but if you recall, this modified the hardship distribution rules that are applicable to 401k and 403b plans. In my experience, most plans have been amended for this. The amendment deadline, however, is December 31st, 2021 with respect to those changes. The Secure Act, Larry talked about a few of those changes. Those included in increasing the required beginning date to 72 modification of distribution rules for death benefits and the long-term part-time employee provisions that Larry talked about. The amendment deadline for those changes is December 31, 2022 for calendar year plans, or if you're a non-calendar year plan, basically by the end of that 22 plan year date. CARES Act is really similar to the amendment deadline for the Secure Act. If you recall, the CARES Act contained a number of changes with respect to coronavirus-related distributions. You can also have increased loan limits in 2020 and a waiver of 2020 RMDs. The amendment deadline is December 31st, 2022 for calendar year plans. Again, if you have a non-calendar year plan, it's basically the last day of that plan year that ends in 2022. For pre-approved and other defined contribution plans, the deadline to adopt those restated plans. So many of you may have adopted your pre-approved plans previously from your record keeper, for example, the Fidelities, Vanguards, T. Rowe Prices of the world. The deadline to restate those amendments, and in my experience, this process has already started with most of the big players, but the deadline for that is July 31st, 2022. So we want to keep those amendment deadlines in our heads as we move forward with respect to our retirement plans as well. I think at this point, I think we have a few questions to address, and I'll kick it over maybe to start with Larry to talk about some of the retirement plan questions we got.
Yeah, thanks, John. I just, we have two questions here. One here is, does the long-term part-time employees change include 403B plans? And it does not. If you recall, 403B plans have a universal availability requirement, and the requirement there is for part-time employees, if they're not working 20 hours a week, you don't have to cover them, but it can be very difficult to administer that. So I know a lot of 403B plans tend to include part-time employees as eligible. So it does not include 403B plans, but there are other requirements for 403B plans. If you have any questions more specific about that, be happy to help. Please feel free to reach out. I see the other question here. Isn't it the responsibility for the participants to keep us updated on their address? And I think arguably, practically speaking, yes, but the DOL is going to look for plans to actively implement procedures to find missing participants, ensure that benefits are paid in a timely fashion. So, at this point, I think plans need to be prepared to, put procedures in place to find people who have, stuck their head in the sand and aren't reaching out to you. And we'd be happy to help out with suggestions on tools that you may have, some that may be available to you now, others that you may be able to search out to locate missing participants. That's all I have, John.
Thanks, Larry. DJ, do you have any questions to answer?
No questions for me, John.
Okay. So I think from my questions, there was one question about a health plan provider denying an employer from offering the dependent care increased election amount because they are not a calendar year plan. I think I'd have to have a little bit more detail on that. My initial sense is no. I mean, this is a regulatory change that is if we, again, these changes are optional, but if we elect to implement the change, that should be permitted. Now, sometimes it may depend on your specific contract or relationship with the provider, but again, there might be some details there that we need to look at further. But to my understanding, there's not an ability to deny an employer from offering that dependent care increased amount as a result of a non-calendar year. Let me see here. There is a question about the independent review requirement of the ACA applying to denials of reasonable alternative requests for surcharges under the medical plans. Not an issue I've ever looked at before. I mean, my initial sense is that the answer is no. I mean, typically the independent review process deals with determinations such as whether there is an experimental or investigational type service or whether it's medically necessary. So my gut sense on that one is that that would not apply with respect to alternative requests for surcharges. I don't think that that would be an ACA eligible independent review process. And the last question is, what will happen to participants who had the Cobra subsidy and do not resume making their payments? Well, I guess it depends on when their payment deadline comes up. Again, there is this extended period for making those Cobra payments. So if that once that extended period, and again, it gets complicated with these rules of pushing the Cobra or the payment obligations out. But once those extended periods expire and the payment's not made, then that's when we can cancel the Cobra coverage. Otherwise, we're still in this until the national emergency period ends. We're still in this period where there is a grace period or an additional grace period with respect to making those payments. And one last thing that I wanted to mention, I think when I was talking about implementing amendments with respect to the health carryover or the health FSA carryover of 550, I believe I mentioned that if you were doing that, implementing that first for 2021 into the 2022 period, that you wouldn't have to amend the plan until the end of 2022. It's actually the end of 2021. So if I said the 2022 on that particular scenario, it's the end of 2021 if you're trying to implement it now. We appreciate you attending our webinar today. As always, we appreciate your feedback. So if you're able to fill out those surveys, we would like to see them. And certainly we will look forward to working with you and for the rest of this year, 2022 and beyond. So have a good afternoon.